So, up till now, we have talked about depression and its prevalence among cardiovascular disease patients, as well as the impact that that poses. And we've also talked about the why this is important for nurses, and why it's important for you to be able to help your patients in this regard. Now, in this video, we will specifically be looking at screening, depression screening, and how to help you familiarize yourself with the tools that are available, and also how to access depression screening in the electronic health record, iCentra. So we've talked about what it means when we've recognized this depression, and what it does to our patients and why it's important for us nurses. But now we kind of get to how we get to that point. How do we determine that there's this problem going on? Um, and to do this, we used verified screening tools. Now, these are tools that have been validated through several peer-reviewed methods and studies um, to determine the degree of depression, as most of this is a subjective issue, people feeling depressed, and we need to be able to quantify it in a way so we can determine the degree of depression in people. And there's several different types of tools that have been used in adults. There's the Beck Depression Inventory, the World Health Organization Wellbeing Index is another well-known tool, the Patient Health Questionnaire 2 and Patient Health Questionnaire 9 are common tools, as well as the Edinburgh Postnatal Depression Screening Tool. Most women have used this one before. So, kind of touched on it briefly, but why is screening preferred over simply asking the patient if they're depressed? Well, these screening tools, when appropriately used, help us turn subjective information that the patient is giving us into an objective measure that we use to determine degree of severity. A lot like our pain scales that we use. We can oftentimes see, the patient is in pain, but we want to know what their subjective perception is of their pain, so that way we can treat it appropriately. So, looking in what way could you, as a nurse, initiate depression screening for your patient? While it's not a required component of um, our patients stay in the hospital, you could talk to them about including it with your admission assessment paperwork. Um, that this is hospital documentation that helps us treat you while you're here in the hospital. For a patient who is displaying some signs or symptoms of depression after their admission, or after talking with the patient, you could say that you have some concerns about their emotional health and stability, and want to discuss the impacts of mental health among heart disease patients. Those are just a few examples of some things you could do. And now we look at which tool that we will be focusing on. Um, the validated tool that is mostly used in healthcare settings and it is available in iCentra. It is the combination of the Patient Health Questionnaire 2 and the Patient Health Questionnaire 9. These tools are named as such due to the amount of questions that are part of the questionnaires. The PHQ2, or the Patient Health Questionnaire 2, is the first two questions of the PHQ9. And why are these tools selected to be utilized within a hospital setting? Well, there are several reasons that would prompt the use of these tools over other tools. These tools require very little time to be completed. They're electronic and easily accessible. They require very little training or orientation to understand how to use them, and they're validated and efficient in detecting depression and determining severity of depression. This tool is actually recommended by both the American Heart Association and the United States Joint Task Force as the tools of choice for screening cardiovascular disease patients. Now we'll cover really briefly how to use these screening tools. It's very simple. You will do the first two questions, which is the PHQ2. And these questions are specifically looking at interest or pleasure in doing things, as well as feeling down, depressed, or hopeless. And you will ask the patient in the last 2 weeks, how often have you felt these things? And then there will be four different answers: not at all, several days, more than half days, or nearly every day. And each one of those answers has a number attached to it. For the first two questions, if the patient's score adds up to more than 2, then you need to continue on to do the additional 7 questions, which are part of the PHQ9 screening form. In the same format, just addressing different topics about signs and symptoms of depression. After you complete the entire screening form, or the PHQ9, it will give you a cumulative score. And from there, the score will be outlined as far as degrees of depression. And you can then look at this and say, oh, my patient has moderate depression, they have minimal depression, or they have severe depression. So now that you've completed your screening form, what do you do? Let's say, for example, your screening score shows that your patient has a moderate to severe depression. You should then take this and carry it forward to the interdisciplinary team and also talk to the patient about what this means. Care coordination is a great place to bring this up, to talk to the social workers about making sure that there's appropriate follow-up after they leave the hospital. You can update the physician's team if you're rounding with them on their patient, or if you need to call the hospitalist coordinator in order to update them. The main component is just ensuring that there's appropriate discussion between all members to establish that this issue isn't going to just slip through the cracks, and that it will be addressed outside the hospital. Now we will look at how to access the PHQ2 and the PHQ9 within iCentra. So step 1, you will come up to the ad hoc, where you locate your forms for blood. You can also find your admission paperwork here, and you'll all click on that. And then step 2, from there you will go down to this folder on the left side and select all items. For step 3, once you open this folder, there will be quite a long list of available folders, and they're in alphabetical order. You want to go down to nursing tasks and open that folder. Once you open the folder nursing tasks, it will open up another section on the right that shows a list of different forms, and it's also in alphabetical order. And from there you want to go down to depression screening tool. Once you click on depression screening tool, this form will show up. And this is the first part of the PHQ2 and the PHQ9. And it will have these first two initial questions for you. Once you answer these two questions, the patient's score will show up in this bottom box. And from there, if the score is greater than 2, I know on this form it says greater than 4, but if it's greater than 2, you should really continue on to do the rest of the form. In order to do that, it won't automatically select the PHQ9 for you. You'll have to go on the left-hand side and select the additional form to complete. As you can see here, once you select that option, the rest of the questions will populate, and you'll be able to continue going through them with your patient, and it will give you that cumulative score down in the bottom, as well as the scoring criteria or degree of depression. This concludes video 3, talking about depression screening tools. Now there will be 2 mastery questions, and please feel free to pause the video so that you have time to read through the scenario, as well as to select the appropriate answer. Once you have finished with these questions, we look forward to seeing you in video 4, where we'll discuss why all of this is important and what we have hoped to accomplish by doing this education module. Thank you.